Thank you for considering Yun Plastic Surgery, YPS, for your body contouring surgery. Now, body contouring is something that I do quite often and basically every week in my practice. And there are a number of different surgeries that we offer here at Yun Plastic Surgery. So during this introduction to body contouring surgery, what I'm going to do is give you the various procedures that we do and get you ready for the next step in your online pre-consultation. So what is body contouring surgery? Well, body contouring surgery basically is contouring all the different parts of the body with the exception of the breasts and the head and neck. And those two areas, the breasts and the head and neck, will be approached separately on this pre-consultation course. So body contouring is all those other procedures if you take out the head and neck and the breasts. So what are the procedures that I do here at YPS? Well, the first thing, and probably the most popular of all of these, is liposuction. Liposuction, as you know, is a surgery where we remove fat. And it's best done in people who have stubborn areas of fat, but they are at a reasonable body weight. Okay, and so typically if we're going to consider liposuction, it is not a weight loss surgery, but it is a surgery to remove stubborn areas of fat in somebody who has a healthy body weight. A tummy tuck is another surgery that we do for body contouring, and this is primarily to remove the excess skin and tighten up the underlying muscles of a tummy, typically after a woman has had children or either a man or a woman has lost a lot of weight. So this is a very popular surgery to tighten and flatten the abdomen. It does entail significant scarring afterwards, and so there is a bit of a trade-off there. But if you've had children and or you've lost a lot of weight and you've got a lot of loose skin of your tummy, then a tummy tuck may be a great option for you. Paniculectomy is kind of like a cousin to a tummy tuck. And so during a paniculectomy, what I do is remove excess skin that is hanging from your tummy. This is typically the surgery that we do when somebody has a lot of extra skin. So I do see patients occasionally who have so much hanging skin from their tummy that it literally hangs at the level of their mid-thighs or even their knees. In those patients, a cosmetic tummy tuck where we tighten the muscle and move the belly button and things is usually not a very good idea. It's too extensive. So for some patients who have a lot of this loose skin and we just want to get rid of it, then we can do a paniculectomy, which is a faster operation and an easier to heal operation than a tummy tuck. Fat grafting is also considered body contouring, and where we inject fat most commonly for this type of surgery is in the buttocks. And so the idea then would be to liposuction fat from other parts of the body, the abdomen, the hips, the waist, the back, purify that fat, and then inject it into the buttocks. Anywhere from about 30 to 70% of that fat, on average about 50%, will stay in the buttocks to fill them back out and to give them a nicer, rounder shape. And the final surgery that I do as part of body contouring is an arm lift or a brachioplasty. And this is surgery that we do to treat those dreaded bat wings or the excess skin that can hang from the upper arms. This is a surgery that removes that skin, but it does it at the expense of a scar that extends from your armpit all the way to your elbow. So not the most popular surgery because of the scarring, but for those people who have a lot of extra skin of their arms, either from weight loss or from the aging process, this can be a very, very effective operation. Well, it's very important to realize, though, before you come in for a body contouring surgery consultation, is that these surgeries are not weight loss procedures. If you are overweight, especially if you have a BMI over 30, then body contouring surgery is probably not a good option for you. The first thing you need to think about is overall weight loss. So some people will ask, well, can't I use liposuction to lose weight? Well, just for your knowledge, the FDA recommends if you're going to take more than 5 liters of liposuction off somebody, to have them spend the night overnight in the hospital and to consider having transfusions available so that in case they lose a lot of blood, you can transfuse them with blood. Well, that's a little bit of a scary thought. Once you go over 5 liters, you may have to transfuse somebody. Well, I don't want to transfuse any of my patients if I need to for cosmetic procedures. And so, if you think about it, the maximum then the FDA recommends short of needing a transfusion is 5 liters removed. Of those 5 liters, probably 4 liters is going to be pure fat, maybe less. And that really comes down to maybe 8 or 9 pounds. So to liposuction 4 liters off somebody is probably about a 4-hour operation. It's a several week recovery time. and you lose a total of 8 or 9 pounds in the end. Is that really worth it? There are a lot of ways that you can lose a lot more weight than that for a lot less money, a lot risky, and you're going to actually feel better by doing it that way. So the first thing, if you're considering body contouring surgery, realize that this is not a weight loss procedure. You want to lose the weight first prior to undergoing the body contouring surgery. So I do require, if you're going to come in for a face-to-face consultation and we are going to consider definite surgery, your weight must be stable. If you've gained a lot of weight recently or you've lost a lot of weight recently, you really want to make sure before you come in for the face-to-face consultation that your body weight is at a stable location. If you come in and you've gained 20 or 30 pounds in the last 6 months or so, then we're going to have you come back later on and delay your operation because we don't perform surgery until that weight has stabilized. And ideally, you need to be at a healthy weight. If you're overweight, then body contouring is not a good idea for you, and we're happy to refer you to some weight loss physicians. But once again, plastic surgery is not necessarily what would be in your best interest. So once again, I'd be happy to see you in a face-to-face consultation. This is just the first step, the introduction to body contouring surgery. What I would encourage you to do is think about what parts of the body you would like to improve, and then go to the next section where we'll give you the various options. Things like, I've got excess skin on my tummy, and I'll explain what we can do for that. I've got unwanted fat pockets, what do we do for that? And so go to the next section of this online pre-consultation, and I will give you all the various options that you have for the problems that bother you. So thank you so much for watching, and I'll see you in the next video.